So yesterday we went over a video that reviewed how to test and see if adhesion is what's causing the nerve entrapment, causing your carpal tunnel syndrome in your hands. Now, not every bit of hand tingling or symptoms in your hand is carpal tunnel. It can come from different sources. So we're going to go over today what some of those sources are and what they mean. The first couple sources here are going to be peripheral nerve entrapment. So ones in your arm, likely exacerbated by adhesion and the inflammation that comes with overworked muscles. So this purple area here indicates the median nerve symptoms. This is going to be basically most of your palm into your thumb, these fingers, the back of these fingers. This nerve actually goes through your carpal tunnel. So this is going to be true carpal tunnel. Next up, we have the ulnar nerve. It's going to be on this medial edge, the edge along your pinky. It's going to take the pinky and maybe half your ring finger, and it's going to do pretty much mirror image both sides. If it's just these areas, it's coming from your ulnar nerve. The nerve root is coming also from the ulnar nerve, is coming from the base of the neck. Now if there was a disc problem here, it's going to have a slightly different presentation. So if it's ulnar nerve entrapment, it's coming in your forearm, at your elbow, and it's going to present like this. Finally, the radial nerve. If it is affected, it's not really going to exhibit anything on your palm. It's going to be mostly on the back of your hand. But what if that's not the problem? What if it's something else? What if it presents differently? Let's get into that. So if we look at this, now we're looking at what are called dermatomes. Dermatomes are a pattern of basically a symptom referral pattern that goes across your body. They come to every little bit of your spine. Each disc, each nerve root from there will refer to a certain area. So if on the palm of your hand, it looks like this, and it's the middle finger, maybe some of these, or like this, these are different nerve roots coming from the neck. That means that disc is at that level is irritating that nerve. Now, there is no C8 disc. It is generally coming out by C7. So that means C7 disc can cause either of these. So if you're at C6, which is near the middle/lower part of your neck, it's going to go into your thumb, maybe into your pointer finger. C7 is going to be up that middle finger, maybe a little bit of these other two, and it's going to be on both sides of the hand. It's basically a stripe down the middle. C8, where that ulnar nerve is, it's going to look pretty similar. So that's going to need a little differentiation. You're going to need to do a couple orthopedic tests. This isn't going to be something for a lay person. This is going to be something for a doctor or some sort of specialist to review these symptoms and figure out what's going on. Finally, the least likely one, but depending on your health history, maybe the most likely, is going to be something like a visceral referral pattern. As you'll see here, the inside here into your chest indicates a heart problem. Now, this is going to be somebody that probably knows they have high blood pressure, their blood lipids aren't looking so great, they're probably not really in shape, and they're going to have significant chest pain with this. So this one is going to be, if this is happening, it's going to be hospital time. But the other two are very fixable, and they're fixable in our office. So there are other tests that we can do to determine is adhesion at play here that's leading to the compression of these discs in the neck that are referring down to the hand. There's other tests we can do for that. We're going to go over that next week.